Can you share with us what it was like growing up in Iran, especially regarding the cultural attitudes towards women's health and how that shaped your early life perspectives?
Yeah, for sure. So first things first, Iran is a very beautiful country with a rich culture, with very nice and hospitable people. The food is extremely delicious. The culture is very beautiful. And everyone is very well educated there. The literacy rate in Iran is actually more than 90%. And everyone that you meet are either studying masters or PhD or have like 2 PhDs. So everyone is very, very well educated. And so going back to my life of actually growing up there, I was a woman. I mean, I was born and then it got mixed with I'm a woman. So yeah, let's just cut this after. So I'm a woman myself who was born in Iran, and we came to Canada when I was 14, 15. And similar to so many other countries around the world, unfortunately, the topic of women's health is very taboo. Mm-hmm. It's not just specific to Iran, it's the story of so many other countries, which is very heartbreaking. So the matter of women's health is a very taboo topic, and specifically women's health and sexual and reproductive health. And growing up, I saw female individuals around me, like friends, relatives, who they always had to like sort everything that was related to the reproductive health in private. And they would even like shy away from talking about it in front of their dad, their brothers, or I remember like vividly, my cousins would even like shy away from showing their period cramps and the pain that they are in front of their dad or their brothers. And I always like, and I was always like, this shouldn't be like that. And we like, why should we be ashamed of that? Like, why should we treat it as if this is something like secret, or it's a very sort of private thing. It's not, it's your physiology. So you have to like be okay with talking about it with your dad. Mm-hmm. So that had a really huge effect on me. And then that sort of laid the foundation of me wanting to sort of change this taboo. And so I started Fibra years after that experience. We started Fibra with the mission to break this taboo and empower women to have access to the right information regarding their reproductive health, their sexual health at the right time in the comfort of their home. So that with that knowledge, then they can decide what they want to do, they can be diagnosed with diseases as early as possible. And if something is wrong, if they're feeling a pain or a burning sensation or anything, they don't have to wait until it's too late for them to go to the doctor. Like they have all the information at the tip of their finger.
Mm-hmm. And do you think that from your experience when you moved to Canada, do you think the taboo around reproductive women's health is generally the same as it was in Iran, or is it a little bit less?
It's a little bit less, obviously, but there is still a lot of work that should be done even in Canada as well. Mm-hmm. And that work is actually us starting by talking about it, and us talking about menopause, talking about contraceptives for women, talking about menstrual cycle, vaginal discharge, all of that. And the more we talk about it, the more publicly, the more we're breaking those taboos.